Welcome to Mind Your Mental Health channel, a channel for mental health awareness, psychological health and well-being. In this channel, so far we have done 18 episodes, of which 15 to 60 episodes were about mind. We were talking about different aspects of the mind. And from this episode onwards, we will be talking about mental illnesses or mental disorders. There are a number of mental disorders. Probably we can go up to 100 or more than that. We'll try to cover some of the very common and important mental illnesses. In this episode, the 19th episode, we are going to talk about depression, or we call it as a depressive disorder or depressive illness. World Health Organization, in one of their studies, pointed out that nearly 280 million people were suffering from depression. Among them, nearly 10% of that group of patients are child and adolescent. And it is also one of the leading, I would say, second leading cause for disability in people. Because when the mood goes down, everything goes down. The thinking, the expression, the talk, the activities, involvement and achievements, progress, everything goes down. It is something like battery going down. And if the battery goes down in your phone or mobile, slowly everything goes down. All the functions come to a standstill. Similarly, in the depression, when depression goes down, it affects the ability to work, ability to look after family, ability to have a social relationship, ability to kind of fulfill your social obligation. All those things will come down and causing a huge disability. That's why depression is considered one of the most common cause for disability in people. In some of the studies, they said that it is the second most important cause for causing disability in the general public. So these 3 pointers which I've said indicates that all of us need to have some knowledge about depression so that we can understand what it is, and if ourselves or somebody near to us, relative, has some of these symptoms, we should be able to pick it up and say, okay, this could be a problem, then you can go to a GP and discuss about it. So everybody need to know. That's not the only reason. Other reason is this particular disorder can be quite reliably diagnosed and treated in different health setups, especially primary care services. Primary health services will be able to diagnose and treat them at that level, mostly the mild and moderate depressive disorders. So what I've said so far is, why it is important, because so many people suffer from depression and it is one of the second leading cause for disability in people, and women suffer more than men, and it can be easily diagnosed and treated in different healthcare settings. Not necessarily it is a kind of only exclusive to mental health services, because mild and moderate depression can be treated at different services. But some of the studies say that only 25% of the people suffering from depression actually access the adequate or appropriate mental health treatment. That puts us in a place where are we lacking awareness? And when I say awareness about every group, every professional and general public. So that is one of the important reasons why people should know about depressive disorder. Okay, I've talked about the importance of the depression or depressive disorder. Next, you might ask me, how do people diagnose depression? What are the signs and symptoms? Now, if I have an infection in my chest, symptom is cough. I can bring out a lot of phlegm, I can have fever. So that indicates there is some problem with my lungs. So how do we find out depression? And you might already know some of the symptoms. Now, a relative of yours might have suffered, or neighbors, or you yourself gone through some depressive symptom. Before going on to these symptoms, let me also explain to you one important aspect. Our mood is a normal phenomenon in our mind, in our day-to-day life. Our mood goes up and down. Now, sometimes it is fine, I'm very happy because something good has happened. I got a promotion, or I got a pay increase, something good is happening around me. Then I feel happier. So mood goes up. I feel more energetic, and I'm kind of enjoying everything. Similarly, my mood can go down. Now, I lost something very, very close to me, some object, or I lost a relationship, or a student failed in an examination. These incidences or events can also make a person feel low or sad. But this level of going up and down should remain at a particular level. If it goes beyond certain level, it becomes abnormal. Or if it goes down certain level, again it becomes abnormal. So we need to differentiate between normal variation of the mood and when it is abnormal. That's where the symptoms come in. Not only symptoms, there are other parameters. We'll come to that a little later. There are a number of symptoms to indicate that a person could be going through depressive phase or depressive disorder. The most common one is sadness. They feel sad in themselves. They don't feel happy. Sadness. With sadness, misery comes. They feel miserable. They might express. They might tell you, I feel so miserable nowadays. I don't feel like doing anything. So sadness, misery, and a sense of gloom. Now everything looks dull. Now everything moves slowly. I feel very gloomy. So these are some of the symptoms of depression. And they can have despondency, a feeling of despondency. That can lead on to hopelessness. Then they might have anxiety and tension. They feel something is going to happen. Now they feel very uneasy. They feel very tense all the time. Now they have palpitation, hearts beating faster. They might perspire. They feel aches and pains in the body, feeling tense all the time. There are a number of anxiety symptoms then come into depression. Depression and anxiety can coexist. Sometimes depression also presents with anxiety symptom. Then they can have a crying spells because they're not able to cope. The sadness is overwhelming and they feel nothing is going to improve. Then they feel like crying. So they can break down and cry. Depending on their kind of a mental makeup, personality, how they are and what are their beliefs and attitude, they might break down easily or they might resist, and ultimately they can break down due to the sadness. Then what we call lability of the mood. Lability of the mood means mood is very touchy. Now, I am a very resilient person. I can withstand anything. Any sad even. I see a very sad movie, my friend will be crying, I will not cry. In that kind of a person, when there is a depression comes in, when they are suffering from depression, the mood can be very labile. What I mean is, they can break down, they can start crying, or they can dip in their mood very quickly due to external events. Now, I am watching a movie with very sad ending. In a normal course of time, when mood is fine, when I don't suffer from mental depressive disorder, then I might see the movie and then say, okay, it's a movie. When I am depressed, the movie can trigger a response. Now, crying response. That is what we call lability. So very quickly they can break down and start crying. Then they can become irritable. Their tolerance comes down. They don't tolerate things. The smaller things they might explode. It can lead to problem between husband and wife. Now wife is depressed. Husband may not understand she's depressed, but what he would probably observe is she's getting more and more irritable. Smaller things she was tolerating earlier, she's not able to do that now. She explodes. She becomes very highly irritable. So irritability can be one of the symptoms of depression. Then loss of satisfaction. So there is no satisfaction in anything what I do. Suppose I am having a depression. Whatever I do, I don't get satisfaction in that. The next is I don't enjoy things doing. I love football, so I watch football all the time. Now, when depression sets in, I might lose interest in football, or I don't get the enjoyment from the football. Technically what we call anhedonia. So lack of enjoyment. Then lack of interest. A person is interested in so many things. A person interested in cooking, making different cuisine, different dishes, suddenly loses all the interest. Now they don't feel like doing anything. They feel it is a very difficult task. So loss of interest in activities which they were interested earlier can also be an indication for depression. Then self-esteem. They may lose the self-esteem. A person who was very confident in his work and a skilled person suddenly think that I'm not good. I'm not good enough for that. So self-esteem can come down. They might say I'm a bad person, or I'm not an efficient person, or it can turn on to their physical appearance. They say I'm not looking smart, I'm looking this way, that way. So self-esteem comes down. And there is a sense of inadequacy. They feel I'm not up to the mark. I've been doing all the work. I was number one employee in my factory. My work used to be appreciated by everyone, but I don't think I'm doing that kind of work now. I've lost all the skills. They may not have lost, but they think they have lost. So the sense of inadequacy is there. And sometimes depression can also lead on to apathy. They may not laugh, they may not vibe with people, they may not play with children, they just look blank without any expression. There is no emotional reaction. So that can also be a part of depression. Then they can become very indecisive. They cannot make a decision. So let's say you say, let's go out for a dinner today. They might initially say, okay, let's go. Then they'll say, no, I don't want to come. Then say, okay, we'll go because you're asking me. Then they say, no, I'm quite anxious. How can we can drive to that place? It's quite difficult to drive. Very heavy traffic. I'm not up to it. No, let's not go. Then they might change. So they have a kind of a very difficult to make decisions. And very importantly, when the depression sets in, grows further and further, they can develop hopelessness. Hopelessness is not a very important aspect of depression. It also tells us the severity of the depression. Despondency, lack of self-esteem, all those things lead to hopelessness. What it means is they are losing hope of getting better. They think, I'm not going to get better. This is how my life is going to be. I will never get well. That can lead to very, very strong negative consequences and thoughts. Then when the hopelessness becomes more and more deeper, they can develop suicidal thoughts because of the hopelessness. Because they think nobody can help me. This is what I am in. It's not going to go away. I'm going to suffer like this for lifelong. Then why should I live? That is the next stop. So they develop suicidal thought. They can probably think about it, plan it, have an intent. Sometimes they can also attempt it. And they can blame themselves for everything which is going around them. Oh, this is because of me. Or now a mother, suddenly child falls ill. When the mother is depressed, she will blame herself. She says, I haven't looked after the child well. I wasn't feeding the child well. That's why child has become unwell. So they self-blame, they blame themselves. And they feel worthless. They feel worthless and they feel, I can't function well. So I am a worthless person. Now I'm not helpful to anyone. I can't help anyone. I can't do anything. I'm complete disaster. No, that is worthlessness. And with that, they can also develop poor concentration. They won't be able to focus on things. They can't read. They can't work. Work requiring concentration becomes very, very uphill task for a person suffering from depression. And because of the lack of concentration, they don't register. They also become forgetfulness. They forget things. And they might express inability to cope. These are all some of the symptoms. These can be grouped into somatic symptom, what we call it as somatic symptom, that is bodily symptom and psychological symptom. So whatever I said, most of it are psychological symptoms. Bodily symptoms, they feel tense, they feel restless, moving up and down, they may lose appetite, they may not sleep well, they might lose interest in sex, they can develop sexual problems. Now, in a men, they can develop erectile dysfunction, in women, they can have orgasmic dysfunctions. All those things can come in. These are all bodily, they can also develop constipation. And these are all bodily symptoms of depression. I have listed so many symptoms. I probably would have told you about 30 symptoms overall. So there are 30 symptoms. How do you go about? How do we make a diagnosis? I'm not expecting you to make a diagnosis. I'm giving you this as an awareness now to know what is depression, how people suffer, what they can experience. When we come to the diagnosis of depression, symptoms alone not is enough. Because I can feel sad because I lost my watch, which was given to my grandfather. It has a very sentimental value. One day I've lost it. So on that day I'm going to feel very miserable. On that day I might feel like crying, but I will cope. And that probably night, I couldn't sleep because thinking about that. So much attached to the watch, I've lost the watch. And next day things will come down a little bit, or next 1 or 2 days. I might say, okay, lost, so what to do? Okay, let's carry on. 2 or 3 days later, I'll be perfectly fine. I may not even think about it. So that is a normal variation of the mood. Something negatively happens in life, we react and get over it. Our coping mechanism kicks in and then brings us back to the... So, looking at all these symptoms, eliciting all these symptoms, we can reliably make a diagnosis of depression in any healthcare setting. Whether it's general practice, surgery, or an orthopedic ward, or in a cardiology unit, or gynecology, obstetrics, any branch in medicine, or any professional should be able to come to a fairly good understanding that this person might be suffering from depression, or they can go ahead and make a diagnosis of depression. I talked about symptoms of depression. I've explained to you about the normal variation of mood, and when it goes beyond certain limit, we call it as abnormal. When it's low, mood is low, we call it depression. Next question will be, how do we make a diagnosis, or how do we kind of come to the conclusion this could be depression? Usually it's done by professionals. They are trained in that, and they are trained to look for it and then ask questions to elicit more information. With that information, they will triangulate and then come to a diagnosis. Two cardinal symptoms usually we look for is, one is lack of interest, losing all the interest and pleasure in activity they used to love. Now they don't drive any pleasure in that, or they completely lose interest in activities. That is one. Other one is lack of energy. They feel run down all the time. They don't feel like doing anything. Active person going to work and performing well, suddenly everything comes down. They don't feel like doing anything. They just lie down and keep awake. Not that lie down and sleep. They'll keep awake, but lie down and just do nothing. Or they sit in a corner, don't react to anyone, they don't talk to anyone. Children will come and play with them, they don't feel like playing. So they feel zapped completely, complete loss of the energy. That is another important symptom we look for. In addition to that, many of the other symptoms what I've listed, I listed about 30 symptoms. Any of these symptoms can co-occur with all these primary symptoms. So it could be difficulty in concentration, worthlessness feeling, or excessive or inappropriate guilt is another important symptom. They feel guilty about everything. They feel it is because of me. That's when I said self-blame. Self-blame comes with the guilt. I've done something wrong, that's why I'm suffering. So those kind of things will come. And hopelessness, as I mentioned earlier, it is also important symptom to look for. The hopelessness can lead on to suicidal thoughts, and recurrent thoughts of not being here or wish I'm dead is a passive thought. When it becomes an active thought, they feel like do something. They might even plan something in your mind. So that is some of the accompanying symptoms of depression. And sleep, as I said, loss of sleep or loss of appetite. And because of loss of appetite, they lose weight also. Loss of weight could be one of the symptoms. And agitation and retardation. In some of the severe depressive form, they feel agitated, they feel restless. All the time they will be moving up and down. They can't sit in one place. They sit and then get up, go there and come back and sit. So that restlessness, agitation will be there. In opposite side, to opposite that spectrum, they can be totally withdrawn, retarded, what you call psychomotor retardation. All the activities will come down. They don't feel like doing anything. It can go to the extreme level, what we call is a depressive stupor, where they don't drink, they don't eat anything, and just become kind of a very stuporous. They don't do anything. And that is a quite life-threatening situation. That's indicate a very severe depressive disorder. So all these things together, the information we elicit about all these symptoms, the duration, and the effect the symptoms has on their different aspects of life, and any other disorders like physical health problem, all those things, all the information is collected from the patient. That's why you spend about at least an hour with the patient to get all this information. With that information, we kind of look into it, analyze it, and then come to a firm diagnosis of, okay, this person is suffering from depressive disorder, and this person needs treatment. And when I talk about the symptom, there's a couple of things. One is somatic symptom, which I already talked about. Now, constipation, loss of appetite, sleep is, all those things are somatic symptoms. Sometimes they can also develop psychotic symptom. We will talk about psychosis in few episodes. Psychosis is a severe form of mental illness where they can get very abnormal thought, what we call as a delusion, or they can have experienced something like hallucination. So depression can come with both this, delusion and hallucination, delusion alone. That we call it as a depression with psychotic symptom. So these are all indicative of severity of the depression. So then comes, is depression one entity? No. Depression has different types. It can manifest in different ways, different types. There are a number of types. I'll mention few things. So one of the type of depression is called episode, depressive episode or single episode depression. That means I get the depression, I suffer from depression for a month or two, I go to a doctor, they make a diagnosis of depression. This is my first depression in my life. I never had anything before. This is the first time, and they treat me. They treat me with medication and counseling, psychotherapy, all those things, and then in about 6 months to 1 year time I get well. I get well completely, all the symptoms gone, 100%. Then that is called depressive episode. That one episode is a depression, that's all. You may not get it back again. I may not get it back again. So that remains as one episode of depression. So that is one type of depression. Then people can have repeated episodes. I go to a doctor with depression, he treats me 1 month, 2 months, 6 months, I'm all right, get well about 90%, and then doctor says, you're fine, carry on, you need not see me again, let's not have a review, continue the medication for 1 year, and then probably you come back and then we'll see whether we can slowly withdraw and stop it. I go back, I'm fine for a couple of years, then I get a depression again. This is called recurrent depressive disorder. That means that depression recurs. So this is one type of depression. Then we have dysthymia, that is chronic depression. That means they have a symptoms continuously for a number of years. Now usually we say if the patient suffers from continuous depressive disorder symptom for about 2 years time, then we call it as a dysthymia or chronic depression or long-standing depression. So this is another type of depression. Like that we have different types of depression. Of course there is a bipolar disorder. We'll talk about it little later in another episode. Bipolar disorder by definition is high moods and low moods. When the mood goes high, they go to manic space. When it comes down, they go to depression. That is one kind of depression. Then in olden days we used to call it as a reactive depression. Now we call it as adjustment disorder with the depression, where you react to the life situation. You lost something, lost somebody you love so much, and that can lead on to depression. Now then That is another type of depression. And there are depression occurring around the menstrual time in a woman, what we call premenstrual dysphoric disorder. And there is a depression accompanying grief. Grief is a process, it's a natural process which lasts for about 3 months, 6 months, depending on so many factors. Usually people get over the grief period by themselves, with a little bit of support from the family, elders and friends. But when it continues, it can go on to depression. So that is kind of a grief leading on to depression. And postpartum depression, now after the delivery, after the childbirth, a mother can go into a depression, very severe depression, and that is called postpartum depression. Like that, we have different types of depression. And each type, there's a subtle variation in the treatment. That's why a doctor will once he makes a diagnosis of depression, let's say a patient comes to me, then I make a diagnosis of, okay, I can confirm that this person suffers from depressive disorder or depressive illness, and then I'll try to classify it, I'll try to type it. So I might say, okay, this patient already had 2 depression. So in the past 5 years, this is the 3rd time she has come to me with the depression. So this is a recurrent depressive disorder. Then the treatment is different. Duration of medication might be longer. So that's how we diagnose and treat depression. There are a number of other seasonal affective disorder where during different season people can feel depressed. So these are all different types of depression. A doctor, a psychiatrist will, when he assesses a patient, he will also assess what type of depression, and accordingly they will treat. So that's about the depression, symptoms, how they make a diagnosis and types. Next, naturally, the next question is, what causes the depression? Why do people suffer from depression? That's a $1 million question. Because in psychiatry, many things are abstract. And the problem doesn't come with one reason most of the time. For example, I have a cough and I bring out a lot of phlegm. And doctor examines me and tells me that you have infection in the lung. He can fairly say you got a bacterial infection, or he examines, does some blood tests, x-rays, all those things. Then he might say you got tuberculosis infection in your lung. So there is one cause. A tuberculosis, that bacilli has gone into my lung and then occupied there, and kind of an increase in number. That has caused the problem. So we can say it's a disorder caused by tuberculosis, single organism or single factor. In mental health, we can't say like that. It is multifactorial. Different factors contribute to one particular disorder. When you come to depression, we always talk about biopsychosocial model. What it means is, biological means body, bodily changes and bodily reasons. Psychological means my psychological makeup. My experience, all I've gone through from my childhood till date, and my psychological makeup, all those things called psychological aspect. So psychological reason and social reason. What are the social reason? What am I doing? What kind of family situation I'm in? What kind of a society I'm in? What kind of work I'm doing? Everything counts as a society. So a mental illness can be caused by biological factor, psychological factor and social factor. All 3 play a role. Sometimes one aspect will play a predominant role, major role. Others might not have that kind of a role. So, but usually we look at the patient with biopsychosocial model. That's why we take so much history about their bodily symptoms, body problems, all those things. Then we talk about their mood, their psychology. Then we also elicit more information about their social milieu. Where did they study? What is achievement? What work they do? How is the marital life? And how is the housing? All those things, how is the income, finance, are they okay? All those things, information we elicit to see what is the problem, why this person has developed depression. Okay, that is the introduction to causes of depression. Then let's say one by one. Now, what is biological reason? One of the important biological reason is the neurotransmitters. It are chemicals in the nervous system, especially in the brain. There are a number of neurochemicals. I don't want to confuse you with so much of information. Like dopamine is one neurotransmitter. Serotonin is another neurotransmitter. I mean, you might have heard this serotonin, dopamine, because it's commonly going around in the social media. So there are other number of neurotransmitters. The changes in these neurotransmitters, the balance, whether it goes up or down, depending on that, patient's mood can change. And neurotransmitter is implicated as one of the reasons for depressive disorder. There are a number of neurotransmitters involved, most importantly serotonin, dopamine. There are other neurotransmitters also. And in biologically, genetic can play a role in causing a depression. Now, when I say genetic, don't think if the father has a depression, son should get it. It doesn't work that way. It's not, that is called different kind of a transmission, father to son or mother to daughter, mother to son. What we are talking about is inheriting a propensity to develop depression. Not that my father has a depression, I should get it. I might get it because I have the propensity to develop depression, but it depends on other factors, other biological factors, other social factors, other psychological factors. If those factors are not impinging on me, I may not develop depression. So when I say genetics, don't be alarmed that father gets it, son should get it. Now, it doesn't work that way. It is not the direct, what we call autosomal dominant transmission. That doesn't happen here. We inherit propensity to develop depression when things go around us in a different way, or it satisfies that biopsychosocial parameter, then the person can develop depression. So genetics is one of the causes. It's one of the many causes we are talking about. Then hormonal causes. Now, all of us know that we have different hormones in the body. Some of the hormones, when they are low, they can cause depression. For example, classical one is thyroxine. When the people have thyroid problem, if the thyroxine comes down, it can present as a depression. It can cause a depression. So these are all biological reasons for a person developing depression. Psychological, there are a number of theories. Now, there are a number of eminent psychologists, psychiatrists, and contributed to the development of psychological theories. There are a number of scholars who have contributed. And cognitive model is one, from which we get the cognitive behavior therapy. And learned helplessness is another model. Learned helplessness is a model where a patient or person is getting into the situation where he can't get out of the situation. At the same time, he is suffering. Now, that's called learned helplessness. That can also lead to depression. There are many psychological factors. Now, loss of an object can lead to depression, and loss of a self-esteem can lead to depression. There are a number of psychological factors that can cause depression in an individual. And then the third one is social cause. Social cause, so many things which are happening around us socially, marital relationship, work, and financial problem, all this can contribute to depressive episode. As I said, it is not the straightforward, it is a biopsychosocial model. So stressful life events, now bereavement or divorce or marital breakdown or relationship problem, illnesses, chronic illnesses or chronic severe aches and pains where patient constantly suffers, all these things can contribute to depressive illness. Now, it can trigger, depending on the person's personality, their resilience and support system they have, all those things can lead to depression. And so money worries, especially, you might have heard, you might have read in press, like how general population went through a lot of mental health difficulties during COVID period. It was a very traumatic period for us. All of us went through that. Irrespective of where we are and what we were doing, everybody suffered because of the COVID. Whoever had resilient, who were able to cope, who had good support system, they came out better than other people who didn't have that. So COVID period saw nearly 25 to 30% increase in depressive illnesses. Now, there's a study which says that gradually, those 3 years, gradually we can see depression, the people coming with the depression increasing. That is the time everything was down. Even health services were coping with a lot of difficulties. We didn't have 100% services. So all this contributed to that 3 years of misery. We are slowly going back to the normal level now. So that social changes, mainly economic deprivation, all those things can cause depressive illness. So this can contribute in addition to all the other factors. Okay, so we looked at the depression as a concept, signs and symptoms of the depression, and what makes a diagnosis of depression, and types of depression. I also talked about the causes of depression. The last one thing which is left is the treatment. There are effective treatment available. Remember, when I say treatment, I'm looking at depression as a different types of depression. It's a group of disorder. There are different variation depression. Now, depending on the variation, depending on the symptomatology, depending on the cause of the depression, the treatment varies. In a depressive episode, what I said, one episode, after that everything is fine, that probably might need a treatment for a year or two. Then we can stop the medication. Then they can lead a medication-free life. But when it is a recurrent depression disorder, then we need to continue medication for a longer time, probably 3 years to 4 years, 5 years. When it's dysthymia or continuous depression, where they suffer from depression years and years, they may not completely get well, but we can give them the treatment and support system, all the other things, to lead a normal life as far as possible. So it's possible to support them. It's not that you suffer from dysthymia or long duration, nothing can be done. Many things can be done, but what we realize is we are not looking at 100% clearing of all the symptoms. So that is another one. And when we have a depression reacting to some life event, then we'll give them more than medication. They require counseling. More than medication, they require therapy to learn some skills to cope with that kind of a problem in life. So treatment depends on what type, what the presentation, what are the risks, and what are the dynamics. Okay. So if we want to classify the treatment into we can classify into two major categories. One is the medication, what we call pharmacotherapy. So pharmacotherapy is one of the important aspects of treating a depression. There are a number of antidepressants, the medication available. There are about 14 groups of antidepressant. There are about 20, 25, 26, 27 antidepressants available. Each of them, they have their mechanism. Some of them better in some aspect of the depressions. So a doctor, a psychiatrist, a practitioner should be able to select the appropriate antidepressant for that person who is suffering from depression. So medication is one. Next is psychological therapies. There are a number of psychological therapies. There are a few therapies which are more effective. Research evidence is there. One is CBT, cognitive behavior therapy, interpersonal therapy, counseling. All these things are effective in managing depression. In addition to that, there are a few other therapies which use it for very severe depression. This is called ECT, or shock treatment, popularly known as a shock treatment. ECT is a very effective treatment. Unfortunately, it had a very bad press. Now, people think ECT is very cruel, gruesome. They are a very kind of a negative media, but it is an effective tool when it is administered to a properly indicated patient group. In a severe depression with a severe risk of suicide or depressive stupor, when I talked about retardation, everything withdrawn, that kind of a depression, the ECT can work very well. Now you can see the difference in the number of ECTs as we give. So ECT still remains as one of the effective treatment, but we need to be very judicious in selecting the patient who needs ECT. There are very clear criteria for a psychiatrist to go by, and they will select the treatment. But commonest treatment modalities which selected for treating depression is pharmacotherapy and psychological therapy. That is available all over UK, and it is available in primary care health services. It is also available in secondary care. Medication, right now the research indicates that medication is important. There are some different views about it. By and large, medication helps. It helps to reduce the symptom. It also, in some cases, helps to recover completely. Otherwise, untreated depression can lead to risk of suicide, risk of self-harm, all those things. So that's why medication still remains a mainstay. But we also strongly advocate psychological therapies. In fact, in a mild depression, we may not give medication starting with. We might say just go for counseling, go for a therapy, go for a few sessions of therapy, go for what we call CBT, cognitive behavior therapy. There is what we call high intensity cognitive behavior therapy. All these things help the mild depression. If that doesn't help, it goes on and becomes more kind of a severity in intensity, then probably we will give antidepressants. There are a number of antidepressants, and we also combine certain medication with other antidepressant and then treat the depression. So in a single episode depression, usually we kind of look at about 2 to 3 years of treatment. In recurrent, 3 to 5 years. In chronic, we need to continue for a longer time. And you should not stop and restart, do anything with the medication and dosage without consulting the person who have prescribed you, or GP or health professional. That is very important. Another common thought is, I've been taking this medication for so many years, it would have lost the potency. It doesn't happen that way. The particular dose, suppose I'm getting well at the dose of, let's say, 50 milligram, that 50 milligram is my optimum dose. That works, and it works any longer. Not necessary I need to reduce the dose after probably 6 months. If the 50 milligram work, that should be maintained. That is a level body responds to. So long-term medication does not lead to loosening of the potency of the medication. And the antidepressant do produce withdrawal symptoms. What I mean is, when you stop the medication, you develop some symptoms. That is the reason why we say don't stop it without consulting a professional, health professional, because it can lead to withdrawal symptoms that could be more suffering due to the withdrawal. And sometimes it can also lead to complications. Okay, so don't stop medication suddenly. And also, because it has withdrawal, it doesn't mean that it has addiction potential. Some of the patient might think, I've been taking it for so long, so I have become addicted to. As far as the research goes, it doesn't lead to addiction. That kind of addiction, what we see in alcoholism or drug dependence, that kind of addiction, we don't see it in, by and large, we don't see it in antidepressant. So then therapy. So therapy is another important tool, equally important with the medication. Sometimes combination of these two helps much better. So you need to commit to the therapy. When you go for a therapy, you should be completely involved, commit to the therapy. All these things can help to recovery, take you to the path of recovery. So thank you very much for watching this episode. Next episode, we'll be talking about anxiety disorders. There are a number of anxiety disorders. We will take up one by one, and we'll talk to you about anxiety disorder. Thank you. See you again. Bye.